Today we are going to perform the incomplete cleft lip repair. Classically, incomplete cleft lip repair should be done by Millard's rotation advancement technique, as Millard's rotation technique is gold standard and very ancient technique, very proven technique, but it is best suited for incomplete cleft lip. In this particular case, the nasal seal is intact. Only the defect is below the nasal seal till the vermilion border. Rotation advanced technique gives perfect result because of it gives the proper descent of the medial border of the cleft side of the lip. So just let us start the surgery.
और सर आप यहाँ पे आप यहाँ पे आ जाइए.
खुल रहा है
लाइट ऑफ.
अच्छा
बर्बादी कर रहे थे क्या है?
बोलिए मत, यही समझ आएगा.